Hi, Elizabeth. My name is Travis Boss. I am a counselor in training, and I'm excited to be able to talk to you today. I am working towards a Master of Arts in Clinical Mental Health Counseling and getting my supervised hours right now. And then I also have a Doctorate of Divinity in Christian Counseling. So it's nice to meet you. I'd love to for you to kind of introduce yourself and tell me a little bit about yourself to get started, if that's all right with you.
Yeah, of course. So I am a master's student right now. I go to Houston Christian University. I work at the Harris Center. I am a care coordinator in the children's division. I'm completing my master's in clinical mental health counseling. So I want to get licensed and, continue to further my education and my work experience. Um, and I came to you because I wanted to see what the therapy was like on the other side. I've never been to therapy, so it's nice to meet you.
Awesome, thank you. Tell me a little bit about what maybe some of your concerns or goals are. What's it like to work with some of those kids? I bet sometimes that can be stressful,
It's really challenging at some points because I feel like the biggest challenge would be the parents.
right?
I could want to be there for the kid as much as I could, but I can only do that with the parents' help. So working with the kids is not really an issue. It's definitely the parents and navigating through, their dynamic and also being somewhat of a third parent and also parenting the parents. So I would say that it could be challenging just because even though I am a child counselor, I am still working with adults that also, need counseling. But I love it. I love working with the kids. Every day is a different day. I never have a set day. So yeah, I'm out in the field. I'm also with social services. So I will be working with juvenile correctionals. I'll be with out of placed kids who may be in foster homes or hotels. Um, so yeah, I really like that I'm able to make a difference.
Excellent. That sounds super fun. Um, Yeah, you talked about dealing with the difficulty of parents. Let's talk about kind of my theoretical stance is a hybrid of things, but mainly family systems theory. So I'm very interested in the dynamics between parents and children, and I like to do some mapping. If you've ever heard of genograms, I feel like that's a good way to take a look at our family systems, and we try to include three generations at least, and include all of our extended family too. Would you be interested in kind of talking about what that might look like? And we probably won't have time today, but in the future, we'll actually map one of those out and include as much information about your family as possible. So if you wouldn't mind, give me a little bit of your family history.
Yeah, so how far do you want me to give you my grandma's or just
Yeah,
my
start with
mom?
your grandparents on both sides and just any tidbits of information that you think might be relevant.
Okay, sure. So on my mom's side, my grandma was a house cleaner. She just cleaned houses. She came from Mexico when she was about 21 years old, I want to say. And she was just working on getting papers for my mom and her siblings. So she took to housekeeping, and my grandfather, which is my mom's dad, he was a painter for NASA. When he came over, he got a job and retired there. He was there, went there and stayed there. And my mom herself, she was an office manager and she was a radiologist. So she was doing ultrasounds and x-rays and things like that for breast cancers. And then she went into office manager before she passed away. And so on my dad's side, my grandmother is a nurse. She was a RN in the children's unit for Bentab, and my dad did not know his dad, so I don't have any information on my grandpa.
Mm.
But my dad himself, he works for Ford and Honda in the parts department. So he manages those two and all of the parts. I'm not sure exactly what he does. It's just he's a car man. So he also manages other dealerships and repair shops in Houston. And so yeah.
That I resonate with that a lot. My dad has been in the car parts industry as long as I can remember. And actually, in my business career, I worked in finance for a Honda store for quite a few years. So I really
Uh,
appreciated the parts and service guys. I'm a lot different than my father. I like, kind of sitting behind a desk or interacting with people, kind of the business world, or I really appreciate this style now. But I
yeah.
like to walk my keys over to the service department when something was wrong with my vehicle and know that they were going to take good care of it and I didn't have to do it.
Right.
But yeah, those
Yes.
guys, my dad loves his job and the way he gets to interact and help so many people. He is highly respected by many mechanics and truckers and farmers in our area. So it's good, good work.
Yes,
Um,
it is.
cool. Do you have any siblings?
I do. I have a sister. She is a physical therapist at Memorial Herman, and she graduated from UTSA, and she completed her master's with U of H. And so, yeah, she is the first one in my family that went to college and kind of set the pavement for us.
Excellent. That's familiar to me. I'm the oldest. I have a couple siblings, but the first one to go to college too, and definitely the first one to go to graduate school. So I'm
Yeah.
enjoying that. Let's see. Are there any uh, do you have any history that you're aware of like mental health issues or any substance abuse issues potentially, or any any physical like genetic disorders that you think might interact with your future plans or with any um, goals or concerns that you have at the moment?
Um, I personally don't have any alcohol abuse or substance abuse issues. My dad, I would say he was an alcoholic majority of my life growing up. He's definitely gotten better. He did fall off the wagon once again when my mom passed.
Mm,
So he was pretty
I
down for about a year or so.
bet.
Um, but yeah, he definitely I would definitely say he would be considered an alcoholic. Um, any disorders? I'm not sure. I know my sister, she has heavy anxiety, intense anxiety, I would say. Um, I I was never very anxiety prone. I feel like I've kind of started becoming more anxious after the passing of my mom. And so like in new ways that, I've never been like financially stressed. I don't know why, like all of a sudden I am just like super anxious, even though like I know I'll have, money for rent, money for what I want to do, I will still be kind of like anxious and be careful of what I spend. I don't know if it's because it's like a safety that I feel was taken from me when she passed along.
Sure.
Um, so yeah, I would say that was. And she just had a medical condition. She did pass away from heart failure. So she had high blood pressure and things like that. I'm not sure or aware if me and my sister have anything. I know that's genetics because my grandma has diabetes, my mom had diabetes. But we've gotten tested so far, we have nothing. So we definitely strive to be healthy and active, I
Yeah.
would say.
That's
But
an
yeah.
interesting one in my I'm a type 1 diabetic. My father's a type 1 diabetic. So it's interesting when I did my own mapping to kind of see that genetic predisposition that some of us had for the type 1 diabetes.
Hmm.
So something you definitely
Yeah.
have to manage, and it's good to check your blood sugars and keep
Yeah.
up with that. So we'll do some of that in the future. So a genogram is just a visual representation of your family tree, and it includes like all the relationships and the patterns or significant events, and we'll kind of explore those family members' roles and connections, and work on that. I think it'll be a fun activity in the future. So next, I'd like for you to, if you have any significant concerns right now, um, think about what we call the miracle question. So suppose that you're sleeping tonight and something magical occurs and that you wake up tomorrow morning, whatever problem you're contemplating has just vanished. So how would you know? What would be different?
If my problems vanished,
Right.
um, I guess I feel like I wouldn't have anything on my mind.
Would be at ease.
Yeah.
That's a good way to put it. How do you think your life would change?
Um, I feel like I would definitely move not not more aggressive, but like I'd move more like more carefree. I would move like maybe more bolder, like less double thinking or like in your mind a lot, or have like, less anxiousness. Like even though you studied for that test and you probably got 100 and you're still like, what if I didn't? Like what if there's still like I get, a B or C. So yeah, I feel like moving more with a firmer purpose,
Right.
confidence.
Right. So describe kind of the ideal scenario. What's your ideal life scenario right now?
um Pertaining to like an issue I'm having.
Yeah, and generally.
um I guess it would just be finals coming up and just my school. I feel like most of my focus is on school right now. Everything is doing pretty well at for work. I've completed new trainings. I'm getting all of my annually trainings situated, so I'm getting that taken care of. Um, so yeah, I would just say also registration. I don't know why registration is so stressful for me. So
Right.
I want to do summer classes, and I already reached out to the counselors and just let me know like what classes I should take. But yeah, so yeah, just school stuff.
Well, I know how stressful that could be. Um, so we're running short on time here, but a couple more things I wanted to go over that we'll talk about in the future. One is reframing. um, Talking about potential issues and maybe like that school issue, how we can kind of reframe our attitudes towards those stressful events and think about the positive aspects. And another one is boundary making and setting boundaries with our friends and family, and it might be especially useful for you with between a heavy workload and heavy school load of making sure you balance your time right, and maybe not overloading yourself and saying no to someone uh, if it might, eat in your time where you need to do other
Yeah.
things. Um, so based on today's discussion, are there any specific goals that you'd like to work on or set before next time we meet?
Um, I would definitely like to become less anxious when it comes to my schooling, and yeah, just kind of learn how to navigate through that without becoming, unsettling and just becoming, stressed about that when it shouldn't be stressful. So definitely just learning how to take it one step at a time.
So on a scale of 1 to 10, where would you say your kind of average daily anxiety level is right now?
I would say it's about like a four,
Okay.
a 3 or 4.
So what do you think some steps that you could take to move towards getting that down to a 3 would be?
Um, I feel like maybe making sure everything is done on time and making sure I have all the information I have for either enrolling or new cases that I'm taking on at work, and maybe more organization.
All right, all right. Well, let's work on those things. So remember that therapy is a collaborative process. So I want to be here to support you through any of that goal setting. So you feel free to ask any questions before the next time we meet. But I want to thank you very much for coming in today and talking with me. And now we'll switch roles, and I will be the counselee, and you can be the counselor.
Okay. Okay. So, hello. My name is Elizabeth Granda, and I am a counselor in training. I am specializing in Gestalt Therapy, and it's a technique that I really enjoy. It focuses on the here and now and the what and how of experiences, and confronting past feelings associated with repeated behavior. This technique focuses on awareness, choice, and responsibility. Um, all of these, the three concepts are what we're going to use to improve the client's mental stability. So I just want to talk to you a little bit about why you came in here today, what you're thinking, what you're feeling, and things like that. But first, introduce yourself and let me know who you are.
Cool. Well, my name is Travis Boss. I'm a student at Houston Christian University, working towards clinical mental health counseling degree. I went through seminary kind of all through COVID, and now I'm looking for kind of a path to licensure to complement my seminary counseling degree. I'm getting married in a couple weeks, so I do have some anxiety about the pressure of that and trying to balance my school load. One thing that's causing me a little bit of anxiety right now is I thought we had spring break that week, looking at the HCU calendar, and now I realize that with for the online students, there really is no spring break, and it's just gonna carry right
Um,
on through. So I'm going
yeah.
to have a very, very busy week in a couple of weeks, and I'm hoping I can manage work and the all of the duties that go along with getting married, and then still keep up with my classwork. So that's one of my main concerns right now.
Okay, right. Well, congratulations. I know it can be tricky, but hopefully after our session here today, you can learn how to manage all of those feelings and fear so that they don't, transfer into projections.
Right.
So, so what do you think that we can do about how you're feeling right now? You mentioned that you're anxious about your wedding and the planning of it, and you're also anxious about realizing that you don't quite get a spring break.
Right. So, I think the biggest thing I can do is be very aware of my need for time management, and balancing that. And then uh, there is a lot of pressure going on there to accomplish a lot of things. I'm going to be entertaining a lot of friends and family. There's a lot to coordinate. We're also trying to do this whole production, as really what a wedding is, right, on a pretty limited budget. So we're doing a lot of the work. Um, Thankfully, my fiance is a designer, so she's really good at that, and I'm pretty good at coordinating things. Um, and so we're able to get a lot done for pretty low cost, but it is a lot of extra work um, on top of that. So I don't know. I think just managing the time will help me to manage my anxiety too.
Mhm. Would you consider maybe well, how do you and your fiance schedule like things to do for the wedding? How have y'all been scheduling things? I know you don't live in Texas, correct?
Right, not yet. So I'll be moving down there after we get married. But we're trying to coordinate all that, and it's been a little tricky, but we spend a lot of time on the phone.
Hmm. Okay, that's cool. Um, so when you're speaking, I noticed that you use your hands a lot to communicate.
Hmm.
Do you do you know like why you do that, or do you have an idea of why do you do that? Is that something that just kind of calms you down when you're getting worked up about a topic that may cause you to have anxiety?
Could be. I'm not sure. I've never really thought about it.
Okay. Well,
I know
it
I'm
could
in
be some.
my Myers-Briggs would say I'm an extrovert, so maybe it's part of that, being a little more animated. I'm not sure.
Yeah, it could be just a defense coping mechanism for you
See?
to. Yeah, okay. Um, so teach me how you navigate through your anxieties and your time management. When you wake up, how do you think of scheduling your day, or what exactly is the order that you do? Do you do things like quickest, what'll take the fastest to what'll take the longest, or what's the hardest to the easiest task, or just take me in a day of your life of planning?
Well, coffee is very important. My Google Calendar is very important to keep me organized, setting reminders for myself. Um, but I don't know, I usually get up and get ready and make some coffee and then dive right into what I have to do for schoolwork for the day. The reading load's pretty heavy, so I try to I listen to audiobooks a lot. I don't think I retain as much listening as I do reading, but
Mhm.
it makes it work. So I'm living way out in the country right now. So I drive into town to work. It's about 20 miles or so. So I have that drive time to listen to my books. That helps be efficient with my time. And then, of course, balancing talking to Joe, my fiance, and getting her. We use the video phone a lot. She's very organized too and very busy as well. So she also is very forgetful, which is interesting. But yeah, she has gotten me kind of into using the Amazon Alexa things. I shouldn't say that. She's going to start talking, but
She does activate. She's ready. She's always
he just lit up.
ready.
I'm like, what? Wasn't talking to you. But um it's for setting reminders and alarms and communicating with each other. Like it's a great tool. So those things help. And I think when I stay organized like that and I communicate effectively with her, even though we're super busy, like it makes things run pretty smoothly. I also like prayer and reading scripture are super important to me. We try to take time to do that most days. And I find when I do that first, it helps with my anxiety. And I just kind of trust God with the situation and whatever that allows me to be a little more content. Even if I feel stressed, I'm like, it'll all work out.
Mhm. Well, I'm definitely glad to hear that you have some sort of relief for you there. And it sounds like routine is definitely important to you. So we want to make sure that
It's-
you stick to that for sure. So what is a um maybe like an issue that you had, or a time that you failed at completing something on time, or maybe something just didn't go to schedule, and so how would you confront that situation as if it was happening right now? Like how would you confront it today with how you've grown and knowing how to, navigate through those feelings? How would you react now versus how you reacted then?
well, I'm sure there's times in the past where I have been um, just stressed beyond belief. Um, the one thing that's very interesting being a type 1 diabetic is if I get super stressed, like I notice it will affect my blood sugar levels. So then I got to keep like an extra eye on some of that.
Uh,
It's
mhm.
just kind of an extra added, like, oh, okay. Um, I found even last night when we were kind of having some technical difficulties, like I checked my blood sugar and it was really high, and then I had to take a whole bunch of insulin, and then it dropped down really low. So that's an extra thing that I have to be concerned about. But um, overall, I'm pretty good these days at just being like, if something doesn't work out, it's not that big a deal. It's not the end of the world. Now that doesn't
Right.
mean that I don't feel anxious. Still.
Yeah.
I don't know if the feelings of anxiety are much different than they were in my younger days, but being a little older and wiser, I suppose, I do handle that anxiety better. And I
That's
think having good
good.
coping mechanisms is part of that, right? Like having
Mhm.
um, a partner who she is very good at listening and understanding, and we're kind of able to play therapist with each other. That's helpful. And then, like I mentioned before, the making sure that I prioritize some time for scripture reading and prayer helps a lot too.
Okay, that's good. I'm really glad that you see that it's not worth it to mess up your health for stressing for
Right.
the moment. Yeah. So, what are some goals that you think that you should focus on continuing moving forward?
Well, I think doing so it's pretty important for me to get good grades. And so far through seminary and at HCU, I've maintained straight A's. Now it seems to get harder as things go on, and I've realized, especially with having some big life changes and moving and getting married and things that if my grades slip a little bit because my time is just I'm just not going to have as much time over the next month to focus and spend as much time writing and making sure I get all of the reading done as I have in the past. So, am I going to be okay with some B's in the future? I think so, but at the same time, like I do get a little bit of anxiety over that. Like, okay, I really want to get through this program because I've done two programs in a row now. Granted, they were a little bit different. It was mainly just writing. I didn't have any tests in seminary. It was just writing projects, and we had a lot of flexibility with our time on that too. So I was able to I don't know, spend the time that I needed. So this 8 week condensed micro semester program is definitely more intense. And it's more like getting the reading done and studying for tests are super important if you want to maintain those A's, I've realized. So I'm gonna have to balance that and decide whether I need to not work or something else has to give or not spend as much time with my new family, which I don't that doesn't seem like a good compromise, but um, I'm going to have to make some decisions in the future as to what's going to be my best course of action as far as managing anxiety and managing my time.
Well, it sounds like a good plan, and just remember that awareness, choice, and responsibilities are the main components here. And it sounds like you have a good understanding and a good grasp of what you can do, what you should do, and things that you should avoid. It's also amazing that you have already kind of two options weighing on which way that you can go, leaning towards one more than the other. Of course, I can understand, but that's amazing. I'm glad that you have that compromise that you can make.
Yeah, thank you. Well, it sounds like we're about out of time here, so we'll have to wrap it up.
Yep.
But um, thanks for listening.
Yeah.